Thank you for attending tonight's webinar, Introduction to Pink Aesthetics for Patient Satisfaction and Profit. For those of you who don't know me, I am practice in St. Paul, Minnesota. I've been a dentist for 46 years, soon to be 47. I'm still a practicing dentist and mentor, educator, and it's a pleasure to be with you tonight. I know in attendance tonight are dental students. So I think this is just going to be an awesome experience for you to take in tonight's material. You'll see some amazing new possibilities for pink aesthetics. I know there could be dental school faculty members here, periodontists, prosthodontists, but it's a pleasure and an honor to be before you, as I've done many times before, on a very exciting new subject. So let's talk about our sponsors and let's thank our sponsors. Let's thank Dental City. This webinar was made possible through the courtesy of Shofu and Dental City. And thanks to Dental City, a distributor for Shofu products and the products mentioned tonight, that they made this possible by inviting you to this webinar. So thank you, Dental City, very much. It's a nationwide distributor of dental products from Green Bay, Wisconsin. They sell quality products at affordable prices so the dentist can give the best possible care to their patients. Thank you, Dental City. And once again, thank you, Shofu. Let's really be thankful for Lou Graham and Catapult for hosting this educational webinar. They've raised the bar for dental online and virtual dental CE workshops, which I've done. Catapult is a forum to learn and evolve our dental skills, and tonight will be no different. So what I'm going to do now as we get into some of the content of the lecture, I am going to stop my video so you can look at the slides and you don't have to look at me. Okay, here we go. Here's tonight's webinar. There you see flamingos, think pink. This is what we're going to do. Now, these are the webinar objectives you signed up for. There's 4 of them. I'm not going to read them to you, but really this is really kind of breaking new frontier for pink aesthetics, whether you're using pink porcelain or pink composites. They're all not equal, all of these ones you can purchase. I'll give you some tips and tricks that I've learned on my pink journey. There's not many instructors that teach pink aesthetics. I'm one of them in the workshops, and how your practice can benefit by offering a wonderful service to your patients that other dentists may not have in your area that you practice. So this pink aesthetics is we're talking about is for patients that don't choose grafting surgery. And we'll talk about all of this in great detail. We're going to go over one clinical case in detail. And we'll find out a lot of things that we know or reinforce, or maybe some things we can learn about the pink aesthetics and the pink composites. This is me. This is what I look like. And this is what I teach. I mentor, and I do a lot of hands-on workshops. Sunshine Act, we have to disclose who we worked for before. These are some of the companies I work for. And for disclosure, I have to disclose that Shofu did pay me an honorarium for this presentation. I have to disclose that the pictures that you're going to see in my clinical cases may have been altered for contrast, brightness, and gamma. No other modifications have been made in Photoshops to any of the clinical cases. What I believe in is the privilege and the responsibility of the teacher to awaken the creative expression of joy and knowledge into the student or the participants. And one of the gifts we have as mentors to see ahead what others cannot see and help them navigate a course to their destination. Tonight would be a good night to embrace this. The presence of pink. Well, we do know a lot about pink, but I think we know more about white. What's above the gum line? What is natural and beautiful is a pink display. It's a gingival architecture that represents the frame for the teeth. And if you don't restore them properly or surgically, aesthetically, prosthetically, it will impair the three-dimensional aesthetic outcome of what we do. And patients are becoming very mindful about this, especially younger patients today. Let's talk about the trilogy of pink. This is something I coined. Number one is the gingival recession. This is what this webinar is about tonight. Number two are black triangles, which is really something that people are really seeking treatment for to eliminate the black triangles. And number three, exposed crown and bridge margins, implant abutments, things like this. The trilogy of pink aesthetics. Well, what is the future of dentistry and what do we talk about pink? Gingival recession is one of the most common healthcare conditions found in our patients today. We've all seen it. Every day we see it. Low-level persistent trauma of toothbrush abrasion, chronic inflammatory periodontal disease, periodontal treatment, and occlusal trauma. Well, we're living longer in America today, and we have an aging population, but they retain their teeth and they want to retain their youthfulness. So when you look at the age 65 plus, 64% present with isolated, moderate, severe periodontal disease. You look at the aging population, the 65 and older are going to double by 2060, and 80-year-old and older will triple by the year 2060. We're going to see a lot of gingival recession, black triangles, exposed roots, cervical decay, wedge-shaped defects, exposed crown margins, all of that. We need a treatment plan for gum recession. When we talk about gingival recession, we're going to be talking about pink class 5s that you can do tomorrow. Make it simple and easy using your technique, or maybe learn something from me tonight. We'll make it simple and easy to understand. We'll start with the easy case, and then we'll really get into that and give you some tips and tricks that you can learn from me. Do you see gingival recession in your practice? The answer is yes. Every day you see it at different stages. What do we do about it? What do you do right now about it? Do you refer? Do you treat? Do you ignore it? Do you refer to a periodontist? If left alone untreated, you get higher morbidity. If class 5 root defects are decayed and sensitive, most likely you're going to do a white class 5 and make the clinical tooth, the crown, look longer, disproportionate, and not the symmetry. So this is what we do. We refer to the periodontist for tissue grafting? Well, the answer is yes. Of course, we can do that. It's the best aesthetic and optimal biologic treatment option. What if the patient doesn't want that? What if they want to be left alone, but they want to do something about it? What can we offer than a white class 5? What if they don't want to undergo the surgery, the healing and discomfort? Pink can be a practical aesthetic outcome for gingival recession. Pink is just a new color more than a new technique. So let's look at this. This is going to make sense. For decades, I did white class 5s. I moved the teeth up into the gingival zone, didn't know any better, didn't have any other options, and most of the patients were knowledgeable about this, but they didn't think it looked natural. So teeth up, it's a white class 5. Gums down, using pink composites for gingival recession, it's a pink class 5. This is not a new procedure. It's a new color. You do white class 5s daily. Now it's a pink class 5. If you place white on a root defect and it doesn't come off, or leakage or sensitivity, inflammation, if your technique works, it's just going to be a new color, a new improved option that we have. It's not a different technique, it's just a different color. So what is pink aesthetics today? Well, it's an illusion. It's an illusion where pink is where it wasn't before. It no longer existed. Now we're putting a simulation or an illusion back. It's non-surgical, cost-effective. You can do it in a single appointment. It reduces and eliminates sensitivity on exposed roots. It's minimally invasive. It's made possible by companies that have invested in pink composites, especially Shofu, and it's a great service for your patients to appreciate, and they share that with their friends and families, and it's a practice builder. So this is what pink aesthetics is. And this is going to be fascinating because we've been using pink ceramics for years. I'm very involved with this with the periodontists and the dental laboratories to create simulated gingiva, artificial gingiva. This is something that's not new. They've been doing it for years. The labs were the first to use pink. Now the dentists are just starting to catch up thanks to Shofu and other manufacturers who sell the product. However, I have not seen much education with the product. Thank you, Shofu, for doing this. So pink porcelain has been used for years. Why not chairside? Well, think about this. Pink can be used for gingival recession. Pink porcelains can be used for provisionals on large aesthetic cases. Implants, periodontists are starting to use this, so are prosthodontists. Why not chairside? It's a single visit. Now, what makes this special with Shofu's material, it's a nano universal hybrid with antibacterial and therapeutic properties. The shades that we're going to see coming up on a few slides can be custom blended using the same shades as porcelain. It's non-surgical. It creates the illusion where pink doesn't exist without the healing and discomfort. So these are reasons why we should do this. Where do we get the pink composites? Well, from distributors. And Ameris Gingiva from Voco, I've taught that before. I've published articles for Voco. They have one shade and 3/10. Venus calls her one shade, dental distributor. So they are available. Cosmodent sells one too, I believe. Permaflow Pink from Ultradent, direct sales, one pink flowable, and eBay. Don't risk it. eBay is not a distributor; it's a marketplace, and you don't know where they came from and the how they're made. So I would advise you not to do that. Now, not all gingiva is the same. Not all clinical crowns are the same. Some are A1, A2, A3, 1M1. Some cervicals are darker, A3, A3-5. Well, the gingiva is the same way because especially for an aging population, we have to have the simulated gingival shades that may match the age and the ethnic background of our population. What can we do? Well, we don't call them A1, A2, A3. We're going to call them different shades like light pink, dark pink. We're going to talk about violet, brown, orange. We're going to talk a lot about the different shades of gingival composites, but they're going to be using the same shades as the porcelain, only with different names. So let's talk about Shofu's composite. This is really special, and I was privileged to help develop and launch beautiful 2 gingiva and enamel shades for Shofu in 2016. They believed in this, and their chemists in Japan worked with me and created the gingival shades, the flowables, the things like that, and mixing charts and things, custom shades. We did it all. So this is going to be special, and it has therapeutic properties with the Jymer particles in their composite material. So Shofu has 5 blendable shades, and they're available for distributors like Dental City. So let's look at this now. The 5 blendable shades perfect for treating recession of any race and ethnic backgrounds. The mixing chart is very easy to understand. You can get this online on the Shofu website. but basically it's a paint store. And what we do is have different one shade. You can use one shade at a time, or you can mix and blend different shades and make custom shades, which we'll show you. You don't have to do it. You can use your technique with maybe just one shade and everything works just great. But you can get a more precise shade match with custom colors. You can have the mixing chart create a better shade match. You can preview the custom colors and blended shades right on the teeth before you start the restorative sequence. They're very accurate, and it's an aesthetic blueprint to start your journey with pink. I would tell you not just to prep the tooth and then figure out what color you're going to use. All this should be determined before you start the restorative sequence. And then you can use different colors for different multiple blended in layered shades and more advanced shades. This is some of the benefits of the pink composite line from Shofu, and that you can get from Dental City. So we're going to talk about this, and we're going to make the hard look easy and simple. This is my responsibility tonight on what we can do to make this more doable for you on Monday morning or whenever you want to implement this. What I think is really a benefit, specific benefit that Shofu has over others, I'm not saying others are bad or anything like that, is that the Shofu line has something very interesting called the Jymer Technology, and it promotes better oral health through its clinically proven bioactive and therapeutic properties. Now, this is really interesting, especially in the gingival space, because you're right next to tissue. When you're on the incisal edge, you don't have to worry about that. But when you're interproximal subgingival, the answer is yes, this is very, very important. Look at this, the antibacterial effect, the reduction of plaque formation, ideal for treating gum recession. Acid neutralization to raise the pH in the mouth is essential, especially when you're around periodontium, when you're around tissue that's inflamed. Actually, leaves the tooth surface stronger than the original surface because of its therapeutic properties, and it's therapeutic for the life of the restoration. It's a practice builder. It releases fluoride and uptakes fluoride. This is great. Thank you, Shofu, for your Jymer chemistry. This is phenomenal. I think it's a great job. Look at the study here from Japan about having a restored Jymer composite after 24 hours without brushing, minimal plaque formation. And then without Jymer chemistry, with the fillers, conventional composites, look at without brushing for 24 hours, look at the advanced plaque formation. When you're in this gingival space that we're showing you for the gingival pink composites, this is essential. I believe that the bioactivity, biointeractive activity, the therapeutic properties for this material, it separates it from all the others. I believe in that. It has great handling. It doesn't have stickiness to it. It has all the essentials. So when we look at nature, nature is our teacher. Nature can teach us wonderful things, and nature is a tough competitor. We've all faced the tough competition for nature, and we correlate the materials according to the rules and principles of nature, both pink and white. If it looks like white, what shade is it? A1, A2? Is it milky white? Is enamel white? What variations of that do we need to make it look like nature and do a wonderful service for our patients? With pink, the same way. What shade of pink? What technique of pink? What burrs of pink? What polishers of pink? All these things are essential to emulate nature. Let's talk about the tips and tricks for pink aesthetics. I started my journey many years ago because I was very curious why we keep on doing white class 5s and why they didn't look natural and they weren't symmetrical. I was curious to see what was available, and there wasn't much available at all in 2016. And this started my path of pink aesthetics, my journey, and I developed all this myself. I had no teachers, I had no mentors, I just had the literature, and I was creative enough to think this through and come up with some easy to understand, simple techniques. And what I'll say here, since we're dealing with class 5s, if you're having any issues or difficulties with your prep design, adhesion, placement, tissue inflammation, these tips and tricks will help you. If you are doing everything fine, you can listen to the tips and tricks. You don't have to use mine. Yours work, keep yours, and start your journey right away with pink aesthetics. So what I will tell you, you have to have the right toolkits for the job. As a mentor and an artisan, I keep simple techniques. I keep simple toolboxes, materials, shade guides, mixing charts, the right burrs, the right instruments. Keep it simple, easy to understand, the right polishers, and the right dent and bonding agents. All these are sequenced. All these are a toolbox. All these things are available through Dental City with Shofu products. I work for the corporations that understand this and gives me a toolbox to teach you, my fellow clinicians and dental students. Now, tips and tricks. Well, the first one's isolation. Do you need rubber dam? Well, sure you could if you got the right clamp and isolate that. You can use rubber dam. You can use Optra dam from Ivoclar, Isolite. Isolation, you have to have them, even if you have cotton rolls, retractors, you just can't have contamination of the sites. Now, one of the things I will tell you is just do not pick a burr up and cut a class 5 on the root. You have to put a pencil line, a scribe line that says, where's the white, where's the pink? And when you touch the preparation with the burr, don't touch the pencil line. That's your surveying boundary. That will tell you where the pink is and the white, and it's curved. It's not flat across. You can do that. I don't have an issue, but I will tell you, nature says it's curved. You mark the curved lines, and that's how you do it. How you prep the pink box, I use 2 pear-shaped diamonds, one larger, one smaller, and they're called my Scalpers. And notice I don't touch the tissue. I don't cause any bleeding. Don't do these on inflamed tissue that's going to bleed. You can put retraction cord, Gingitrack, whatever you want, but nothing should bleed. Don't touch the tissue. And come close to your scribe line. That's your Scalper first. That gives you the primary outline of your boundaries. And if your technique works, that's fine. Just keep your technique. Now, I use an inverted cone diamond, a large and the small, to create mechanical retentive preparations by leaving a slight undercut on all quadrants. You don't have to do this. If your technique works, don't do it. But if you want to have more retention, because you don't bevel pink class 5s, you need mechanical undercuts a little bit to give you more retentive qualities in your preparations. I'm a graduate of Minnesota, 1976. We had to do a gold foil for our boards, and this is a GV black gold foil prep for all those that can remember that. Leave a slight undercut. Don't touch the tissue, because your pink is going to come close to it, very, very close, but not touching it. Selective etch at all times. You don't bevel pink composite, so you have to etch the enamel. Obviously, don't leave any loose enamel rods there. Get it nice and firm and do a selective etch. You can disinfect in there with microprime, whatever you want to, and then use a universal dent and bonding agent. So these are some of the tips I'm giving you. The next is going to be a real stickler, and that's dental bonding agent application. Two things are necessary: micro brushes and benda brushes, commonly known as a brush and a mop. Apply the first layer, one and only layer, with a micro brush, scrub it in, and before you air thin it, if you have excess, blot it with a gauze pad and take the extra moisture bonding agent off. And then before you light cure, after you air thin, before you light cure, take a dry benda brush and swipe the sulcus like a windshield wiper. Get any irritants out of there that will cause inflammation, and then you can light cure. That is tips and tricks. That's something I think everybody should be doing. Now, to use a flowable underlayment or foundation, a light layer, very thin layer, you don't have to do this. If your technique works, you don't have to do this. But for wettability and to decrease polymerization, shrinkage, and stress, I use a very fine layer of pink flowable composite from Shofu, very light, and I do not take it up to the borders of the preparation. It is within the preparation. So that's something you can do. And if you don't want to do it, if your technique works, you don't have to do this. This is just a suggestion how to do it. Now, the other thing is the previewing of aesthetic shades. You do this for composites. When you take my courses, we always do shade preview, aesthetic preview. I put the shades with my assistant on there. Which ones do we want? I always put multiple shades. Do we just use one shade? Well, let's pick our best one and put it up there. Or are we going to put two other colors and mix them and blend them together? You get to decide that, how you want to do your journey with pink aesthetics. One is good, curved, the gingival margins, great. Don't touch the gum tissue. It all works. It depends on what you want to do. So how you place the pink material is really, I think, critical. I don't take a big layer and beat it into the prep and scrape the excess away, because now you're pulling it out of the box and you're creating voids. I take a small increment of composite, roll it in my nitrile gloves that are clean, and then I put the first application and I massage it into the preparation, making sure it's convex, not flat, and it is bio-secured, and it has all the sealed capabilities into the dentin bonding agent there. This is something I think is essential, especially if you take my workshops or courses. Once you massage that and see how my layer is curved, it's not flat. If yours is flat, it's okay. You're still doing a good service for your patients. I take a long bladed Explorer, and actually I drag the Explorer from gingival to incisal in one swipe. What does that do? It gets rid of flash. And when you get rid of flash, you get rid of bioirritation that causes inflammation. All you want to do is a very simple, easy cleanup and not have debris and cause tissue bleeding while you're doing this. So this is an instrument that I use when I teach, or when I would recommend for you. The other one now is called a marginator burr. I come up with these names of things because I think they work and I think they're great names. It's a yellow flame diamond. You can get these from Shofu, Brasler, Comet. And what I do is I pull it out of the hub as far as I can without it dislodging. I use it dry, and I go across everything I've done to marginate to make sure I have biointegration of everything and not causing any tissues. That way, if it's uniform, I can go to polishing. If it's not, you go into repairing. This is your marginator burr for biointegration without harming the tissue. Now, what do you do next? Well, you could use discs and things like that. Well, if you do the margination, what you're ready for now is the polisher. Now, there's a whole bunch of different polishers. And so what I'm going to tell you, I love the Shofu One Gloss, because it gives me the right texture of the gum tissue. It makes the pink material look like gingiva. I use this dry. I use this about less than half RPM, very slow, deliberate, and you can add texture to the pink material. And if you don't, you can use high shine with water spray and you can gloss it out whatever you want. Now, this is coming into the pink clinical case that we're going to do. And you're going to rely on my experience. If you haven't done these, I'll show you some tips and tricks. This is going to be your way. This is going to be your white class 5 way. We're just changing the color. Maybe it's the same technique you use for everything. You're going to rely on my experience, what I've learned, and we're going to go over this in detail, and then we'll go into the Q&A. So here we have a Carius class 5 on a canine. So you're doing white every day in your practice successfully, just starting a new way using a different color, and you're doing your patients a favor. You can start these tomorrow with your technique. I'm going to show you how to do it and what I've learned. You can place simple shades or custom shades. This is best practices, whatever you want to do. You can do these with a sulcus or without a sulcus. You can just do one layer, and that's great. You've done a great service. You can place a second layer on top of the first layer and add depth to the restoration and create a sulcus. And for my advanced classes, I will teach you sulcus reproduction, how to do microtexture and things like that. So what do we do first? Well, we take the mixing chart and we put a couple shades. This is light pink and orange. And my assistant Sharon and I, we always negotiate the right color. And then once we determine that, we'll mix them into a homogeneous ball on a mixing pad, and then take one increment out at a time with a ball burnisher using spherical transfer techniques. So shade preview is a good thing to do with your dental assistant. Now, this is my scalper. I put my Scribe Line on, and I'm coming up to my Scribe Line. Notice that I don't touch the tissue. Notice I have a curved anatomical restoration in the cervical third. That's where nature is. You're competing against nature. You can do this or not. You just use your technique if it works. I like retention because when you do a root restoration, all the stress from the clinical crown is coming down into the class 5 area, and that's why you get debonding and things fall off. It is not retentive, but with white, you bevel. With pink, you do not bevel, so I will use a retentive burr. How deep do you go? Not too deep, only deep enough to restore. And if you're using one layer, maybe it's not as deep. If you're doing multiple custom layers, maybe a little deeper to allow for the volume of material. Selective etch. Now, important. Now, sure, you could use air abrasion. You could do a lot of different things. We just don't want to insult the tissue and get into a bleeding environment. This is what we want to do, and especially for my patients that come to see me that are referred by periodontists, orthodontists. I do custom colors, and I do the best I can for my practice. You do the best you can for your practice. So selective etch, you know how to do this. And now meticulous management of dentin bonding agent with a bender brush and a micro brush. Again, start out with a micro brush, only do one layer. You can't reacidify your dentin bonding layer and put a second one on there, because you've changed the chemistry of that to get retention. So start out with a micro brush, take extra off, and then take a dry bender brush and swipe underneath the sulcus with a curved motion and get any irritants off. Now, when you do the flowable, you don't have to. You can use your technique. You can just put the layer in and call it a day. Your technique works. This is great. It's different color. I use a very thin layer of flowable. I use the cannula and I swirl it around in the flowable and move it wherever I want. I keep it away from the margins. I keep it away from causing irritation and mess because you have the pink composite going on top of it. You do it your way. If it works, you do it your way. I'm just showing you what I do, and it works for me. Now, see the first increment of the custom color that I've mixed. It could be just one shade. There's nothing wrong with that. But I will put that into the gingival portion of the preparation, just let it sit. And then with the ball burnisher, I will tease it and tease it into the gingival layer, the gingival seam, and make it convex with my instrumentation. I don't want to do that with a burr. I do that with the transfer mechanism. Now I take a long bladed IPC and you can flatten it out a little bit, make sure it's uniformed, no irritation. You don't want debris outside the preparation. You want less cleanup. So this is why we use an IPC. We want less cleaning duty to cause irritation. Marginate, no irritation, no bleeding. And here, if you want to add a second layer after the first layer, you can cure the first layer and then add a small second layer for dimension and to create a sulcus. There's an art to do that. I teach that in the advanced classes. But you can do this. It's an optional step. And I use a long bladed IPC to marginate and create a sulcus, a virtual sulcus that's not too deep. Now, this is after you do the marginating, after you do everything is the texturization. You can do this with greenstones. I teach that. I teach that with toothbrushes to create micro texture before you like here. But the favorite here is the one gloss from Shofu that doesn't have any color breakdown. It is so easy to use to create surface texture and make the pink material look like gingiva. This is something you have to have, are the one gloss at a slow RPM dry, or you want high gloss, you can put more pressure on it with a lot of water coolant, and you can get this to gloss out. What's the next step in your journey? What do you want to do? Well, either you want to do it or you don't. Don't get discouraged. Make it simple, make it easy, use your technique. Take some of your notes that you wrote from what I taught you tonight and start your own journey. There's a lot you can learn about the pink evolution of materials. I've been doing this for years. And I'm excited about it. And I think we're gaining traction in the dental schools. Some of the dental schools are getting curious about teaching pink aesthetics. I think this is positive, as well as pink porcelains. So what do? Well, you got to get started and get a toolkit. And you have to start with getting something that's sequenced, material, mixing charts, shade guides, polishers, burrs. You got to have the right burrs. You have to have the right instruments. You have to have the right bonding agents with the right applicators. All this has to be laid out by your dental assistant in a sequence of visual simplicity and start your journey without looking for things in different drawers. Now, the things that you should be learning now is you have a lot of questions. And I've spent a lot of time on the pink aesthetics. And the question is, what do you do now? What is your current practice like? Does it work? Keep it. Just use pink. If you want to evolve it a little bit and grow a little bit in your pink journey, well, you can add some of the things I've showed you today from my experience. It's just a different color more than a new technique. And if your class 5s are good and you don't have irritation, leakage, decay, secondary decay, if they're not debonding, well, you don't have anything to change. these tips were designed for your own knowledge in base, because if you come into a situation where something doesn't work, well, you have something to fall back on, and there's videos on the Shofu website that I've done with pink composites. You can start with one layer, simple cases. You can evolve, you can add additional layers for texture. You can start with easy cases and then try harder cases before you become more comfortable. You have to become more comfortable to start the harder cases. Now, the questions, the Q&As are, we'll look to the box and see who has some questions. Do you wet the placement instruments with resin, or do you use brushes to contour the material? Very good question. The answer is I do not wet the blades. Why? The material isn't sticky. It has great handling properties. Also, use clean, new instruments. Don't use a instrument that has scratches and bent. I've done that before. Don't do it. Have clean instruments. You can wipe the blades off, the ball burnishers off with alcohol. You don't need sculpting resin, and do not dip your instruments in dent and bonding agent to use it as a surfactant, because now you're getting active monomer into the composite and tampering with the physical properties. The one thing I've realized too, that when I've taught courses at dental societies, on stage at greater conferences in New York and Chicago and others, is I've been teaching for years, and they're questions that I usually get asked. And here are some of the frequently asked questions. Do I need special technique for pink composite? Depends. If you're already using white composites to treat gingival recession, your restorations are fine. You have an acceptable technique. If you have concerns and some issues with that, don't be timid to start your journey. Start it with easy cases. Simple cases, one layer. You don't need flowable. Maybe you don't need a retentive diamond. Just make it easy. Start your journey simple. Make it easy. Don't start with a hard case. Don't start with a big case. Do you always use selective etch on bonding technique? Always. Even if it's a rim of hydroxyapatite, you need everything you can throw at these cases on the gingival preparations. And that's why I hedge my bets. I don't want debonding. I don't want forces coming down the root of the tooth, coming at the debonding possibility. I use retentive diamonds to undercut, because I've been familiar with the GB black gold foil restorations that you'll see in your practice that last 50 years. Do you need retraction card? It depends. I don't do pink composite cases on anybody with inflamed gingiva. That won't work, because when you desiccate that, it's going to bleed. Even if you put retraction cord, you can put a 000 cord in there. That's not a problem. I don't touch the tissue. If you touch the tissue and you get bleeding, that's not going to work. It's going to be contaminated. Whether you're using white or pink, it's not going to work. So always use common sense, isolation, retraction. Have you had any issues with gingival inflammation? I don't. I'm very meticulous about biointegration at the margin. This is your first increment with a ball burnisher to nudge it into the gingival seam. Spread it carefully to the gingival part of the seam for biointegration and no flash. My layering techniques are meticulous. I spend twice as much time with the overhead light on the chin and work that material, because I will spend half the time finishing, and polishing. You get a smoother transition from the composite to the tooth. I use the marginating ultrafine flame diamond to make sure. That's verification. Too often as a clinician, what we do is we go just to layering, bulk it up, maybe 40%, 50% larger of white composite or pink composite, and then take your burr out and try to make it look like a tooth or a root. I'm not that good. So what I want to do is build it according to the principles of nature. Where did it come from? What did it look like? How do you build it? And how do you minimally finish and polish it without trauma and stress? That's what I've learned. Another question I've been asked, do you have any incidents of sensitivity? Just the opposite. Meticulous management of the preparation. Don't go too deep. If you're chasing decay on a root, just like on a crown, if you're getting close to pulpal exposure, well, you might hedge your bet and maybe put some limelight or something like that as a base, bioactive base on that, and then start your layering and bonding technique. Many of these patients I've treated have had sensitivity prior to coming in. They wanted the sensitivity removed, and they also wanted it to look better. They wanted it to look natural. And I said, yeah, we can do that. We have a pink composite. It's an illusion. What do they mean? Well, you can trick people from 3 feet to simulate gingiva, not from 6 inches, or have a patient look in the mirror from a foot away. That doesn't work. It's an illusion of 3 feet that looks like pink tissue. It's not a perfect match. Anyways, when you use either pink or white in the class 5s, you'll likely reduce temperature and different types of sensitivity. What can you tell me about the Jymer technology? Well, this is another question I get asked a lot. This is the perfect fit for the gingival gum recession preparations because they're therapeutic. Anything that reduces plaque inflammation is a plus for any periodontal patient with gingival recession or post-perio people that come out with black triangles. Anything that can release and uptake fluoride is a positive. Anything that will reduce, change the pH of the oral environment and make it more interactive and bioactive, I think this is a positive thing to do. These are things I know. And the thing about the Shofu products, I'm not trying to say others are bad, is that they work. They have the Jymer chemistry. They handle great. They're very affordable. All Shofu products are affordable. You have to price them out and see what it looks like. So this is what I do in this webinar. Let's field another question. As recession advances over time, do you just add more to an existing restoration? Well, that's called relamination. Now, if I'm doing a white restoration, whether it's BioClear or anything else, I know it's cinched into the preparation. I know it's adhesively seamed. And if I have a issue on the surface, like white or pink, you don't have to take this apart down to the bottom of the foundation to the adhesive level. It's already been verified. You can take a section out or a surface out and use your acid etch protocol, air abrasion, whatever you want to do, and then you can put an adhesive layer on there, light cure it, and just relaminate it. So these are good questions. So I think we've had a good run at this tonight. We're about 10 minutes from closing, and I really want to say before we conclude the educational part of this webinar is don't kid yourself. Pink is here. Is that pink is growing. The population is aging. We're going to see more gingival recessions. We're going to see more dark triangles. We're going to see more carious class 5s on the root on an aging population due to hundreds of medications they take to get xerostomia. And why would you want to put an inert material into that place when you can use a bioactive material? Any questions you have now about the Shofu products, certainly you can contact your Shofu representative about the science of Jymers and the materials, the instruments and burrs. It's on the Shofu website. I've done a nice video for that. And after the conclusion of this webinar, we'll have some very interesting and good information from Dental City and Shofu. Will have a special offer to purchase the beautiful 2 Jymer gingival materials. And I can also say too that if you belong to a study club or dental society and would like to have a presentation for any of your societies, AGDs or something, or pink composites or workshops, you can contact Shofu. They'll answer your questions. And we got a couple more questions coming in here. Well, it's good information. Well, I want to thank you, Dr. Johanna. And I had no teacher. I had no mentor. All I had was the literature to start my journey, and from Christian Coachman, and for the prosthodontist from Pink Porcelains. And I had to equate and bridge this into the direct chairside composites. I had one chance to get it right, and I believe I made some good points on this tonight. I really want to thank the dental students that are participating tonight and listening. Is that we don't want to question your academia and what you're being taught. They're teaching you white class 5s. This is great. Learn how to do them. But just be curious enough when you get a chance that when you get out and practice that maybe you're going to start your journey with some pink class 5s. I've published a lot of articles about this. I'm very passionate about the pink journey. And I'm more excited about your pink journey because this is something that is going to grow as Shofu is, and the dental distributors like Dental City and others are getting us involved with virtual and live education, live workshops. And if this is reasonable for you, then you let your Shofu representative know, because I have advanced workshops with sulcus reproduction. I have advanced workshops for elimination of black triangles, and then making pink simulated or artificial gingiva as well. So what we're going to do now is conclude this webinar. And again, my pleasure to be with you tonight. All of you that were in attendance, and I thank sponsors in Shofu. And now I'm going to say goodnight.